Good evening, everybody, and welcome to another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Belenkin. I am a health librarian at the Greenwich Hospital Medical Library. This medical library is one of the only ones in Fairfield County that has a special section and resources and books just for patients, community members, and for families and caregivers. While we are currently not open to visitors at this time, you may make an appointment with me if you have any health information that you would like me to research you more about or just recommend any resources for you. In the meantime, I do outreach such as these webinars, and I'm very happy to have guest speaker here. Unfortunately, we do not have Dr. Petrotas with us at the moment, but he may join us later. But we do have Kelly Tokars. Would you like to introduce yourself briefly to our audience, please?
Hi, my name is Kelly Tokars. I am the Critical Care Nursing Professional Development Specialist at Greenwich Hospital. That means that I oversee critical care training and education for all of our nursing staff. I have 15 years plus experience in nursing, and I have been at Greenwich Hospital for over 4 years. Thank you for having me today.
Thank you for being here. And this is a very important webinar involving that the emergency room finds itself involved in often, which is on preventing summer injuries. So before we get started, just want to go over a bit of housekeeping. If you are in the audience tonight, we do have a few tools available for you to ask questions only at the end of the presentation, please. So just a quick reminder, this webinar and all webinars created by the Greenwich Hospital Medical Library are designed for educational informational purposes only. Always consult with a healthcare provider before making any changes that may impact your health. So we did go over our introductions. We will go over briefly about the Greenwich Hospital Emergency Department, as well as the services that our newly developed trauma center and trauma bay will offer residents here in Greenwich and beyond. We will go over the most common summer associated injuries that the emergency department sees, as well as provide some prevention tips and symptoms to watch out for so that you know when exactly you need to go to the hospital and when you can treat it at home. I will share some online resources that you can use to consult further that are free, accessible, and very easy to understand, no medical jargon at all. And last but not least, if you do have any questions, please feel free to ask during the Q&A session at the end, or to email me at a later time if you can't think of anything now. So Greenwich Hospital's Emergency Department and Trauma Center. Some facts include that there are 26 beds, staffed by over 40 nurses, 30 physicians, and 20 techs, with significant training in adult geriatric pediatric trauma. They're highly trained in advanced trauma life support, and nurses are certified in trauma by the Emergency Nurses Association. There is a link right here that you can click, or you can go on the Greenwich Hospital general website, search emergency department, and also get you to the same link. And perhaps Kelly, you could go into a little bit more detail.
Certainly, we see many different types of injuries over the year or throughout the year. And we treat orthopedic, neurologic, cardiac, and surgical injuries. We are going to be a level 3 trauma center. We have a new fully equipped trauma bay. And as Veronica had already said, our nursing and our physicians have undergone immense trauma training so that we can be able to support our community and become a level 3 trauma center. So we look forward to seeing you all out in the community, and if you should need in our ER.
Yes, they will be certainly on hand to help with any injury that they can, and we appreciate all the work that you and all the staff that are mentioned here are doing for us all. Thank you so much. So the most common summer associated injuries that we will speak about today: broken bones and sprains, and I didn't mention this in this slide, but we're also going over a little bit about concussions. Swimming hazards, specifically a little bit about drowning, but more so about the illnesses that you can get from swimming. Food poisoning and allergies, and those are just the main few. Obviously, if you have any other injuries that you're curious about, feel free to email me at the end of the or say it at the end of the presentation. Kelly can certainly speak to any others if there's interest. So first, broken bones, sprains, strains, and concussions. It's quite a mouthful, but most commonly they're outdoor or sports related injuries, and it does not discriminate from age. Obviously, with their teens or children's sports that occur during camps over the summer or at school during the summer during practice, these are things to watch out for. But it can also happen during hiking, biking, camping, after school programs, playgrounds, recreation centers. I knew somebody who broke their knee just from walking outside in the parking lot after buying groceries. This can literally happen anywhere. So there are three types of injuries, excuse the typo: acute, overuse, and re-injuries. So broken bones are commonly associated with a snapping sound that are accompanied by swelling, bruising, and hurts to the touch are an example of a serious acute injury. Sprains are any type of stretch or partial tear in ligaments or tissues that connect bones and joints. And strains are any stretch or tear in a muscle or tendon. And when it comes to overuse injuries, they usually mean any certain motions that are accompanied by pain or swelling or have a dull ache when resting. Is there anything you wanted to add, Kelly, about the sprains, strains, and broken bones? Anything that should be important for somebody to know? For instance, if somebody does suspect that they have a broken bone, what do you suggest is the first thing they should do?
They should immobilize the injury as soon as possible. So stop using the injured body part. Veronica, you have the word RICE up here, which is an acronym that we use. It stands for rest, ice, compress, and elevate. Secondly, you're going to want to compress the injured area, meaning, or we like to call it splinting the area. You want to take an ACE bandage or some sort of elastic bandage and wrap it around the injured extremity. And then you want to make sure that you're elevating and applying ice immediately. If you see any deformity, you want to come to the emergency room as soon as possible. That's a pretty severe break.
Very, very good. Good advice. Hi, and this, I should say, hello, Dr. Petrotas. Thank you for joining us now. Best better later than never, you know. So thank you so much for joining us. We're on the slide regarding broken bones, sprains, and strains. Is there anything you would like to add that you think our audience should know about either the RICE treatment or anything about sprains or strains or broken bones in general?
The most important thing is that when the pain is unrelenting, or where you see any signs of the inflammation, which is basically the swelling and the redness, that do not respond to these conservative, measures, to always come to the ED.
And what should people expect when they come to the ED for a broken bone?
They're going to be seen first by the emergency department attending, and then they will be seen by an orthopedic specialist.
Do they have to expect to be staying overnight or anything like that?
It depends on what fracture you're talking about. Those long bone fractures definitely will be admitted into the hospital for sure. Sometimes there are some distal wrist fractures that we just, we cast them and we send the patient home with follow up with the orthopedic specialist. But long bone fractures, yes.
Very good. And then, so commonly when people think of concussions, they think about sports related concussions that come from activities.
Correct.
During football, but also there are common injury amongst young children and even babies who fall or have things fall on them. Is then the symptoms associated can show up right away or even hours or days after an injury. And certain symptoms include confusion, headache, poor coordination, balance, mood changes, dazed or slow speech, and feeling sluggish. Kelly or Dr. Petrotas, what symptoms of a concussion should people watch out for that would require them to go to the ER? Either one of you can answer this.
Sure. There is a sequence of events, I would say. Those who have a significant kind of blunt injury, they will know that right away, and those who are next to them, because they will lose consciousness. So either, let's say, a brief or a prolonged loss of consciousness, that's an immediate visit to the ED, because the brain needs to be scanned. We need to make sure that there's no any injury into the basically the brain parenchyma, as we say, inside the head. Then there is those insidious situations where in the very beginning, I mean, you do have the injury, but people do not lose consciousness. They do not develop right away the headache or the nausea or the vomiting. But then they go home and they start developing this type of symptomatology, especially with a little bit of somnolence, if you wish. They want to sleep, they want to withdraw. Those are symptoms that should alert everybody to come to the emergency room. The majority, I would say, of the concussions, they can be easily observed at home. Okay. Once they are evaluated in the emergency room, they can be discharged and can be evaluated. But a loss of consciousness warrants definitely a 24-hour observation.
Very good. Kelly, do you have anything to add?
Some prevention tips would be to make sure that if you're engaging in any sports or contact activities, please make sure you're wearing your helmets, even when riding your bike or roller skating or skateboarding, to protect your head.
Especially when it comes to concussion. With regards to sprains and strains, online resources such as the CDC always recommend to warm up before any type of strenuous activity as well, to avoid the risk of those two. And broken bones, especially. Either of you guys have prevention tips for broken bones? Besides the protective equipment, of course.
Well, the most important thing that I can think about prevention, besides wearing the right equipment when we do, contact sports or anything which is more elaborate, is to not exceed what we can do as human beings. And what I'm saying is the following. I mean, I've seen in numerous times young people who exceed basically what the human skeleton can take from the point of view of pressure, from the point of view of weightlifting, presented with ligamentous tears because they're of the stress. So understanding one's kind of build and capabilities for performance and what we're engaged into is the most important. And the second most important is to just always wear the most appropriate protective gear.
Well said. Especially with the overuse part. Our human bodies do have limitations. I know in our competitive atmosphere, people tend to overexceed what they can do. But yes, it is very important to make sure that everybody knows their limits and to listen to what our body tells us, especially when it comes to pain, any kind of swelling, or any kind of dull ache when resting. That is for sure.
Unless one's is involved in such a competitive level that we're talking about an athlete, for either a regional, national, or international, it does not usually take that much from the point of view of physical exercise to be fit.
Yeah, if we could go into that more, I'd love to, but we're going to continue on to swimming hazards. That's another commonly associated summer injury. Everybody wants to take a dip during the hot times. So first, we will quickly go over drowning. That is the second leading cause of unintentional injury and death for children's ages 1 to 14, as well as adults. So significant factors increase the risk of drowning: the inability to swim, no fencing around pools, lack of supervision while swimming, specific locations such as the bathtub or fast currents, not wearing proper safety gear, and drinking alcohol or taking medication and swimming afterwards. We don't have many prevention tips other than CPR training and also taking swimming lessons if you're not adequate at swimming just yet. I don't know how often drowning or near fatal drownings occur are followed by a visit to the ED. But we do tell people at CPR training that they should call 911 before administering CPR. So what would they expect if somebody would go to the ED from a near fatal drowning? Kelly or Dr. Petrotis, you can take this.
Sure. Besides the fact that they will be seen immediately by the emergency room attending, there are going to be a series of studies. I mean, a chest X-ray is the most important, okay? Because with drowning, definitely there is the risk of aspiration, and the decision making whether to admit or not to admit, it's going to depend on the severity of certain parameters have to do with the oxygenation of the person who shows up in the emergency department. When it comes to drowning, I tend, believe it or not, to be more cautious than the concussion from the point of view of injuries, because the aftermath can show much later, 24 to 48 hours, when people can develop pneumonias or other problems, and it's not that easy to observe like one would observe, say, a concussion for changes in mental status.
And then we have swimming related illnesses on top of that, that may send you to the ED. Considering certain bacteria can grow in water, certain symptoms associated with swallowing water, contaminated water, include diarrhea, skin rashes, ear pain and infections, congestion, and eye pain. And this is, again, caused by bacteria that live and multiply in contaminated water. So we're not just talking hot tubs and pools. We're talking about oceans, lakes, and rivers that anybody might visit or want to swim in during the summer. And the people at most risk for hospitalization are children, seniors, pregnant people, and people with compromised immune systems. Dr. Petrotis, perhaps you could give us a little bit more detail on how swimming-related illnesses are spread and any sort of prevention that our audience might want to know about.
Right. There are, I would say, two axes that one can see this on. One that has to do with a human being, where we want to enjoy the waters that we're in, and we overexert ourselves to the point of exhaustion. And this is when then the drowning happens, or side effects like heart attacks or cardiopulmonary arrest and so forth and so on. The second one is, where do we practice this one? Okay, how safe is the environment that we practice it? And we tend to look at the infectious diseases as a very important factor, because you don't know what type of bacteria they're going to live in any type of water, irrespective of how big the pond is or what the body of the water that one swims in. So my advice has always been, if has been to the to patients and to people, if this is not something which has been established as an area where we can swim, like a pool, okay, or an open ocean next to a beach with safe waters, not to practice it. Of course, one can go into lakes, and lakes, I mean, the acceptable body of waters to swim. But I say that anything else, everybody takes their own risks. It's impossible to predict the hazards that can be associated either by nature, okay, or by the by the environment that we have around us.
Yes, it's sometimes impossible to control.
It's impossible to control. Yeah, I mean,
yeah,
nature its own mind. It's possible. So that's why when it comes to summer activities, unless there is an established kind of body of water or an area which is safe for one to practice and swim, I would say no. The rest is, I mean, always take a calculated risk. What can happen?
Yeah, so stick to the rivers and lakes that you're used to, like the song says. That's probably the best thing to do. However, I would like to draw everybody's attention to the water quality information for ocean, lakes, and rivers by state, a very handy information resource by the CDC that does actually offer a way for you to check the quality of water within a specific state that you're visiting. So because there are certain departments and health organizations in those states that actually go and inspect certain bodies of water that people might want to investigate. Plus, you can also look into the inspections. Those are made public on a lot of the state health websites on the pools and other recreation areas that host people during the summer. So that is a database that people can look into if they want to be a little bit less of a calculated risk. So unless there's anything else to add, I think we can move on to the next commonly associated summer injury, and that would be burns. I hope both you and Dr. Petrotas had a great and safe 4th of July weekend, and I hope the rest of our audience did as well. But one of the most common injuries that the ED does see are burns related to fireworks. Is that correct? Possible, it's one of the listed as one of the possible causes involved, as well as sunburns, grilling, fire pits, any kind of burning leaves, and kitchen fires from cooking. As you can see, there are to these images, there are 3 kinds of burns. 1st degree burn is superficial, such as a sunburn. Partial thickness and blistering is often accompanied with a 2nd degree burn, and then the full thickness of a 3rd degree burn. Related to burns, but not in a more indirect way. We have heat-related illnesses. So that involves heat cramps, heat exhaustion, and the most severe type of heat-related illness, heat stroke. So all of these are the result of prolonged exposure to hotter temperatures outside that can raise the body's internal temperature at a very fast rate. This is especially true during times of high humidity, when you go outside and it feels like you're almost suffocating. That's how you know that the humidity is very high. Those at the highest risk are infants, children, immunocompromised, people who work outside most of the day, and people over 65 years old. And during the highest point of the sun, that would be around 11 a.m. to 3 p.m. is when most people should keep in mind the images right here. Those are the tips that are recommended during the highest points. And we have a few warning signs of heat stroke, which is the very worst symptom of heat-related illness. That's the high body temperature, red hot, dry skin, rapid strong pulse, throbbing headache, dizziness, nausea, and confusion. So perhaps Kelly, if you wouldn't mind, we all know that sweating is in our biology is meant to prevent this kind of heat from getting to us. So what could cause our temperature to rise despite us having this mechanism to sweat it out?
You're right. So sweating is our body's mechanism to cool itself. Our body temperature raises not only during extreme activity, but also during activities like digestion and during illness. So when we're severely dehydrated or we're not consuming enough fluids, your body is actually unable to cool itself down with sweat because it doesn't have enough fluids to do so.
Mm-hmm. Hence why it is definitely advisable to consistently drink water throughout the day. How often do you think that should be the case? How much water specifically?
We should probably be drinking about 1 cup of water every hour.
Mm-hmm.
We should, even though we want to have some fun in the sun, you should avoid drinking alcoholic beverages while out in the heat. But if you are consuming alcoholic beverages, make sure that you're drinking at least 1 cup of water in between each alcoholic drink.
Yes, don't want to have too much fun in the sun. And then we have a specific, when it comes to heat cramps or heat rash, obviously that's not a cause for going to the ED right away. But are there any other warning signs of heat exhaustion, heat stroke that people should know about that require hospitalization other than the ones listed here?
Loss of consciousness would obviously be one where we're warranted to call 911. I think the warning signs that you have up on this slide cover most of the emergent signs.
Okay. And the CDC have a great first aid list for heat illness. Dr. Petrotis, do you have anything else to add with regards to
there is
heat
a
illness?
correct. There is a how can I express this, a false kind of sense of safety that when we are under the umbrella, which provides some protection from the sun, at the same time we are protected from heat exhaustion or everything else, which is a myth. The hydration should happen at all times, and the umbrella, it's not a protective mechanism. This, as we said, 11 to 3 is the worst time to be under the sun, and hydration is the best kind of prevention. Unfortunately, the sun nowadays is not friendly like it used to be perhaps 50 years ago because of the changes in the climate. But this is very important that we need to cover ourselves, believe it or not, and use a very high degree of reliable products against the sunburns. Now, the heat exhaustion is, as you said, completely different. But it's important not to fall into the trap. Okay, I'm under the umbrella, or I'm in a place where I don't have direct exposure to the sun. It's safe. It's not safe. No.
Yeah, and I think the same can be said about people who are indoors, even during the peak times. If you don't have AC, you're still susceptible to heat exhaustion because even the sunlight through the window can amplify the heat as well. Any recommendations to prevent heat stroke within your own home, possibly?
Wear cool, light-colored, loose clothing. Try to go to a friend's house and sit in their air conditioning if you can. Frequently check on your elderly, children, and those who are immunocompromised or who have underlying comorbidities. And if you do encounter somebody who does appear like they're having heat stroke, always call 911. But you can have the person lie down and you can cool them in their groin, their armpits, or their neck with ice packs. Or just spray cool water on them after you remove any unnecessary clothing. So number one is to make sure that you're cooling the patient until help arrives.
And I mean, we hear this all the time on the news, but making sure that nobody is locked in a car, and that includes pets and babies and kids and the elderly. Keeping those cars insulated if they are staying in the car for a bit. Never keep the windows closed. Put the AC on. It's really amazing how many news stories we hear, such tragic news stories about people being locked in cars and getting into heat exhaustion from that. It's so important to make sure that doesn't keep happening. But if it does, again, like Kelly did say, 911. And if you do see that in the parking lots of wherever you are, it's important that they call 911 and get them out of the car and into the ED as fast as possible. And while this is also, no, we're not going to go into detail about this because this is more of a dermatological issue rather than an ED issue. But when it comes to heat and the sun, it is very important that people know where to turn to identify the symptoms and look of skin cancer. There is a great organization that you can visit online. This is the Skin Cancer Foundation. This is from their site. This is a great images way for you to identify whether any certain marks on your body would be a sign of skin cancer. As I said, we're not going to be able to go into it today, but I highly recommend that you take a look at this website and just keep in mind as you're out in the sun. And when you inspect yourself later in the day, just make sure that you can identify if these marks are just marks on your skin or if they're skin cancer. There's tons of celebrities like Hugh Jackman that are, providing information about skin cancer because even they are susceptible to skin cancer. Nobody is safe from skin cancer, which is why, we keep specifying the sunscreen, but this is a great way for you to identify any melanoma on your skin if you do have it. With that, we're going to turn over to something outside of the sun, which can happen anytime, which is bug bites and how to treat them. Knowing where a bite or sting came from can help determine the treatment, which is why I highly recommend this link, Bites and Stings that contain pictures, causes, and symptoms. And most reactions are hopefully mild. And if they are, you remove the stinger if it's lodged in the skin, wash the affected area with soap and water, and use an ice pack to reduce swelling and a topical anti-itch cream to relieve any pain. However, there are mosquitoes and other types of bugs that can spread viruses such as dengue, West Nile, and Zika from different areas into your area or while you're traveling. That's an unfortunate way that they operate. So Kelly, perhaps you can tell us what type of symptoms or reaction would require going to the ER when it comes to a bug bite.
Severe allergic reactions to the bug bite and signs and symptoms of infection at the puncture site would require a visit to the ER. So we're looking at signs and symptoms of allergic reactions would include severe itching with hives all over your body, difficulty breathing, swallowing, dizziness, fast heartbeat, feelings of anxiety, and especially tongue, throat, or lip swelling. And signs and symptoms of infection would include redness, swelling, pain, oozing, or drainage to the insect bite site.
Mm-hmm. And when it comes to the specific viruses like the West Nile and Zika, Dr. Petrotas, are there any symptoms to watch out for when it comes to these types of viruses, and how would exactly they be addressed at the ED department?
Right. They do have each of those systemic symptomatology that can range from just a headache and just a little fever to a most kind of severe phenomena where one can have seizures. And if when they come to the emergency room with the above, usually there is such a dermatological reaction because there is a rash, okay, which then would lead the attendings in the emergency room or the infectious disease attendings to think about it and go to more specific studies like blood work or spinal fluid and so forth and so on. Unfortunately, when one gets to that point, this one usually predicts a prolonged hospitalization, and it's unfortunate. But at the same time, it's very difficult between the time of inoculation and the time of presentation to say, okay, this is what is going on. Most likely, this is the virus, because it's very difficult to diagnose clinically. The majority of the people who get the disease, they come to the emergency room, and they do have definitely a hallmark of the specific virus on board. And that means hospitalization, and then specialties like internal medicine, infectious diseases, neurology, and so forth.
Yeah, it would require like a multidisciplinary team to examine them. Yes, that makes sense. Hopefully that won't be the case for most people, but it is possible. So it's as soon as you see those kind of symptoms, definitely get to the ED as soon as possible. But in the meantime, there is prevention tips that the CDC offers for specifically mosquito bites. It does say that mosquitoes can spread these viruses more likely in the daytime, and they can also occur at night, but mostly in the daytime. So you could follow our previous slides where it said try to avoid being outside in the peak daytime hours of 11 a.m. to 3. Using insect repellents with the active ingredients of DEET, picaridin, and IR 3535 are recommended to prevent them from getting on your skin. Also, to prevent getting on skin is to wear protective clothing, to long sleeve shirts, long pants, along with the repellent, and to obviously use any type of AC or screens on windows and doors to prevent them from coming inside the home, and to keep maintenance of any of the sources of water near your home, such as pools or hot tubs, so that mosquitoes don't reproduce and lay eggs in the water around your home. Do Kelly or Dr. Petros, do you have any other prevention tips that you think our audience would like to know?
The most important thing is to avoid what you said about the daytime
Mhm.
when they spread the most, because you can take all the preventative measures, but unfortunately, it's we have to think that it's still nature, okay, and it has its own circadian rhythms and ways of acting, because it's completely symbiotic. Okay, it's planet Earth. This is how it is. So it's simple steps. Okay, and it's avoid the whole body exposure in daytime. That's that's the most important thing.
Yeah, when it comes
If
to
it's gonna
being,
happen, it can happen, unfortunately, from a single bite.
yeah,
You need it is an unfortunate event, but and what you said, especially the daytime and being covered, is the most important thing.
very good. And then we'll move on to more detail about allergies. Now, we already spoke about the reaction to bug bites, and bug bites are one of the most common sources of an allergy, specifically the most severe type of allergy reaction, which is an anaphylactic shock. Kelly, would you like to go into more detail about anaphylactic shock and at what point the audience should know when to come to the ED?
So as we mentioned before, severe tongue, throat, or lip swelling, any swelling that occurs around the mouth is something that we call angioedema.
Mhm.
Severe itching with hives, difficulty breathing, any difficulty swallowing, dizziness, severe anxiety, or a rapid heart rate are all reasons to come to the ER for treatment. When patients come to the ER for treatment of allergic reactions, they can be expected to be treated with multiple types of medications or regimens. Oftentimes we'll administer Benadryl. If we think that the patient is experiencing a severe allergic reaction, we'll administer epinephrine, often combined with IV fluids, sometimes steroids and other antihistamines. But one of the most important things to remember when you are having a severe allergic reaction is to remove the allergen. So if you're having an allergic reaction to peanuts that you've eaten, you want to make sure that you rinse your mouth out or brush your teeth to remove any particles that remain. If you're having an allergic reaction to an insect bite, you want to do what you had said in previous slides, and that's remove the stinger. If you're being swarmed, you want to remove yourself from that environment and get away from any of those insects as well.
And with the use of an epinephrine pen, if that is not on their person, would they be provided that at the ER upon arrival?
Absolutely. And they would be observed then in ER for several hours. And if the allergy subsides, then they'll be released.
Okay, very good. Dr. Petrotis, anything to add with regards to allergic reactions?
I have, there are two times that one needs to be very, very concerned. When it comes to kids with an allergic reaction, and when they start, let's say, developing the rapid heart rate or difficulty in breathing, in the very beginning, they're going to be hyperactive. They're going to complain. They're going to cry. They're going to flail. They're going to, run around. When the kid starts to get tired, with the anaphylactic reaction on board, is the most dangerous time of the whole clinical scenario, and one that should be avoided by bringing basically the kid sooner than later to the emergency department, or give the EpiPen, sooner than later, because when they present with tiredness or somnolence, it's way advanced into the anaphylactic shock. Believe it or not, it's basically beyond the curve of the anxiety and the hyperreactivity and the acute inflammatory process, is where basically you lose all the resources of the respiratory system. The second one is the knowing the basically what causes the allergy. Okay, what is the what are those substances or foods or anything that you can think about that can cause the allergy, and just to avoid them. But unfortunately, it happens because we have to we deal with kids. Okay, it's very easy for them to forget that, and these are the most two important. One is preventative, like knowing exactly what is the allergens that they cause the problem. The second one is a high level of suspicion if we have this type of scenario where the kid is tired, because it's not good.
Mhm.
A tired kid with an allergy is just EMS, it's 911, because most likely they're going to need to be intubated.
That's a very important point. You know, kids are curious, and as we're growing and developing, it's hard to know exactly what's gonna cause a reaction until it actually happens. So sometimes, even if we're super prepared, it's sometimes hard to know until it happens. If there is some confusion as to where there might be why you might be experiencing certain symptoms, you might not know the cause. There is a virtual allergist available on the American Academy of Allergy, Asthma, and Immunology. You can pick what body area is having certain symptoms, such as the eyes. It'll ask you which symptom you're experiencing in that location, red eyes, and it'll tell you exactly what it's not exact, it's like generally what might be the issue that's causing that symptom. It can be conjunctivitis, mold allergy, or pet allergy. So aside from going to the ED, this would be a good place to start for somebody who might not know what the source of their allergy might be. And this website is very good just on general information on allergies for both adults and kids. But what Dr. Petrotas said is very important when it comes to recognizing a severe allergic reaction in children. And I think Kelly also mentioned just being able to carry a first aid kit with you with epinephrine in it would be very advisable, correct?
If you have a known allergy, an epinephrine pen would be prescribed to you, and you should carry it with you at all times.
Mhm. So moving on, there is a specific type of bite that is known, especially during the summer months. If you're a very active hiker, you camp, or you're just playing in the garden. Even the most common type of tick in Connecticut to watch out for is the deer tick. Deer are very pervasive in our area, even in the highly big areas such as Greenwich. There are always deer abound. So the ticks that look like this is what a deer tick looks like. So as you can see, for reference, it is a lot smaller than a dime before it starts actually taking any blood from you. It is almost smaller than a dime. So it can be very, very hard to spot on you if it does get on the body. So when it does get on the body, this is a very helpful image from the CDC again, where it shows you exactly and precisely how you should remove the tick from your body to make sure that the stinger itself is completely out of the body. The use of pliers or tweezers are highly recommended, and then to also wash the area as you would for any other bug bite, and to apply a specific ointment on top. Over 15 types of diseases in different geographic areas can be spread by tick bites. So in Connecticut, the most common is Lyme disease, and if it's left untreated, can lead to symptoms such as fevers, chills, aches and pains, rash, and even something called tick paralysis, which is weakness or paralysis from the source of the bite that moves up the body. Kelly, I believe you have some more details that people would like to know about regarding tick bites. For instance, when would Lyme disease actually symptoms actually be present, and how can somebody spot a bite if they don't feel the initial bite on their skin?
So symptoms of Lyme disease can actually take weeks to develop. They feel like flu-like symptoms, severe headache, fatigue, and extreme cases are on your slide, paralysis. If you feel those symptoms, you should come to the emergency department and get tested for Lyme, and we can treat you with antibiotics such as doxycycline and other medications. Things to be concerned for would be increasingly swelling, redness, pain at the insect bite site, and also if you start to develop a bullseye around where the initial tick bite took place. And those are causes for concern, and you should come to the emergency room.
Yeah, so it would literally look like the bite surrounded by a red ring and
Yes.
surrounded by white skin around that red ring, correct?
Correct.
Okay. Dr. Petrotis, do you have any other notes or prevention tips to recommend before we move on to the next slide?
Not for this particular topic, but I just remembered something. I had a patient who in the summer developed laryngeal edema because went to after playing outdoors to drink water from a faucet, and there was a bee in the faucet. So be aware that the bees and wasps that tend to get into the water faucets, and this is how it happened. It is not an infrequent event to have a bee or wasp bite into the oral cavity just because of that.
Wow, I had no idea that they could actually nest there. That's pretty
Yes, they
shocking.
can nest there. They nest close to the water fountains. Yeah.
Yeah, that's definitely something to be vigilant about. Not just in the shutters of the corners of the house, apparently, but also
Right.
in areas of water, not just mosquitoes, apparently. Oh boy.
Mhm.
Something else to watch out for. That's a very good point to have. And this is the last slide we're going to be going over tonight. We're going to be talking about food poisoning. I do have a much more in-depth webinar on food poisoning and food safety that I did with Dr. Shermanker. That recording is up on my website right now. But just a brief overview, there are 4 simple steps to food safety that people should be aware of, and it's listed right up here. So simply put, it is to clean the area where you're going to be cooking or putting food sources on. Then is to separate your food sources of food, specifically your meats, from something like your fruits. To make sure that your meats are cooking at the right temperature, which can be measured with a meat thermometer. And then last but not least, especially in this case during the summer, it is important to chill and refrigerate and freeze your food, because in hotter temperatures, food poisoning can be resulted from bacteria that can grow much and multiply much faster on the food that is left outside in hotter temperatures. So it is important to never leave food out for more than 1 hour, whether you're eating indoors or outdoors, does not matter. It's just to never leave food out for more than an hour, because what will result is something called gastroenteritis, or more commonly known as the stomach flu. It involves the inflammation of the stomach and intestines. Specific symptoms involve nausea, diarrhea, abdominal cramps, and low-grade fever. But there is more advanced and severe symptoms that would require hospitalization. Perhaps Dr. Petrotis or Kelly, you can describe what exactly those symptoms that would require hospitalization are, and how would gastroenteritis be diagnosed and treated if somebody would come to the ER.
There is the most common, I would say, reaction when one has as we describe, one phenomenon of diarrhea, and that is the end of it.
Mhm.
And this is what most commonly people, this one did not sit well with me. And or let's say an episode of nausea and vomiting, that will be the end of it. And this is not uncommon. I mean, let's say throughout the year to happen. There are certain toxins, okay, which are related to food which is not well cooked, that can produce pretty severe toxic shocks and dehydration. And what happens is that it is like a pretty voluminous and non-stop diarrhea, which can cause dehydration and perhaps nausea and vomiting. The most severe presentation is the one where the patient has many bowel movements with which is basically non-stop diarrhea and can dehydrate the patient. Okay, but we do see something which is not related to exactly this slide, but people need to know that a bug which was associated with overuse of antibiotics, that's called Clostridium difficile, has become now the most common bug-associated diarrhea in the community. So that's another reason for them to be very careful if they develop that to come to the emergency room, because it requires definitely treatment with antibiotics.
And you said that
It used to be only something that we used to call it a hospital-associated diarrhea because it was due to the antibiotics, but now it has spread to the community.
with regards to any type of prevention, do you or Kelly have any tips to give to our audience with regards to avoiding food poisoning?
The most important thing is know your sources. In a sense, who is the provider of basically the food? Okay, number one, and trust the sources. Number is thoroughly follow the instructions for cooking. Okay, and frequent hand washing.
Oh, yes. Yes, that is something that I should have emphasized earlier. I do not know why that is not the fifth step that provided by the CDC, but yes, hand washing is the most important, probably the most important direction to have when it comes to food safety. Kelly, would you like to add anything?
I think you both did a wonderful job covering gastroenteritis and food poisoning.
Okay, great. So yes, definitely hand washing is the most important. And please consult the food safety webinar that I did with Dr. Shermanker for even more details, as well as how to avoid food poisoning while traveling, excuse me. So before we conclude, I just want to make people aware that you can consult these websites for even more details and tips on preventing all of the summer associated injuries that we discussed today, including the sports injuries, the just general first aid and safety for the children, swimming safety, as stuff about tick-borne diseases, food safety, and also more on allergies and asthma and just general immunology. That's going to be available here. And you can also click this link because these links will be all over my website, the Stephen Mickley Community Health Resource section. And I'm just going to point this out here now. This is what it looks like. This is also where this recording of this webinar will be posted as well, along with all the other webinars I've done in the past. All the recordings, including this one, will be on this site as well. And I can also send links to anybody who's interested as well. And that is the conclusion of our webinar. I'd like to thank everybody who is viewing or attending. And if you'd like to register for more free and upcoming webinars, definitely go to the events page at the Greenwich Hospital website or call the number listed here. And if there's any questions that you have that go into more detail, you can definitely contact me. And I'd just like to thank Dr. Petrotas and Kelly for joining me tonight.
Thank you very much for the invitation. Our pleasure. Thank you.
I don't think we have any questions. I don't see any in the chat or the Q&A, so I think we'll adjourn for tonight. Again, please adhere to the email or the phone number here listed if you have any questions. And I may consult Kelly and Dr. Petrotas on your behalf if I have any questions as well. So I think we will conclude. So have a great night.
Thank you.
And hopefully have a great summer as well.